I would make sure that we give them non-steroidal sparing drugs if we have to give them longer time painkillers.
So ibuprofen and similar non-steroidals, they are prostaglandin inhibitors, which are vasodilators. And when the vasodilatation is knocked out by these prostaglandin inhibitors.
How does ibuprofen work? Ibuprofen basically works by thinning the blood vessels, by causing constriction. So when you give ibuprofen for a longer period of time, it will increase the water retention in the body.
Welcome to the Wellness Think Tank on OHealth TV. In this session, we take a closer look at ibuprofen, a widely used painkiller that, while effective, carries important health considerations. To explore its impact on the heart, kidneys, and gastrointestinal system, who bring expert perspectives from cardiology, nephrology, and gastroenterology. How does ibuprofen increase the risk of heart attack and stroke?
So the first thing and the foremost thing is going to be, what is the condition that is causing you to take these over-the-counter medications or like ibuprofen? Now, especially in certain age group, like more than 60, I would be very careful. I would make sure that we give them non-steroidal sparing drugs if we have to give them longer time painkillers. But obviously at the end of the day, the bottom line is, why are they having the pain? Let's help them with that symptom. It's not a patch-up job. Let's do this. So the other thing I would consider a lot is what medication they are taking already, because a lot of patients take lots of blood thinners, lots of chronic medications, or the medications that are already having pressure on their kidneys. So this is where I would draw a line and make sure people who are at risk of developing liver problems or kidneys, particularly with age, immunocompromised, or who are taking another medication, this is where I would draw the line.
So ibuprofen and similar non-steroidals, they are prostaglandin inhibitors, which are vasodilators. And when the vasodilatation is knocked out by these prostaglandin inhibitors, that can cause an acute decrease in glomerular filtration rate. So that's at the level of the kidney. But they also cause a rise at the same time of high blood pressure, which can lead to myocardial events, particularly in the elderly with underlying heart disease.
How does ibuprofen work? Ibuprofen basically works by thinning the blood vessels, by causing constriction. So when you give ibuprofen for a longer period of time, it will increase the water retention in the body, and that will cause an increased load on the heart. So that will worsen your heart failure, and it will ultimately lead to heart attack.
Should ibuprofen remain OTC given its systemic dangers, or should access be restricted?
So look, I've got nothing against ibuprofen. I take ibuprofen for my migraine as well, because obviously I've got the kids, so I have to take them. Now, but I would certainly advise, and this is not me just making a new thing out of the box, this is what is already being done in European countries, Western world. There should be a ban or a cut down on the quantities that we dispense. And obviously there's one thing that the Western world has done is reduce the quantity of it. Like if the strength of ibuprofen generally in our part of the world is 400 milligrams, if you bring it down to 200 milligrams, what you do is you increase the pill burden. So if somebody wants to overuse it, they know it plays a psychological effect that you're taking more tablets than the others. But yes, I know there are people who, unfortunately, I will be amiss in saying all headaches or all knee pains or knocks should go to a doctor. I think that would have lots of monetary impacts on general population. But in essence, if you're needing to take repeated ibuprofen, then certainly curb the number and see a physician.
So in general, patients with chronic kidney disease already have compromise in their kidney function, and even a few doses of ibuprofen or related medications can acutely lead to acute kidney injury as well as lead to persistence and worsening of chronic kidney disease.
That concludes our discussion on ibuprofen. We extend our sincere thanks to panelists for their valuable insights. Join us again on the Wellness Think Tank, only on O Health TV, as we continue to explore important topics in medicine and wellness.